What a bunion is actually a misalignment of a joint. These are your metatarsals and these are your toes. You can see that your big toe is twice the size of any other toe and your first metatarsal is twice the size of any other metatarsal. What happens is the big toe moves over. As it moves over, it puts more pressure on this part of the joint, and as a result, you get the bump. So again, a bunion is a misalignment of a joint that causes most of the people's pain. You can get little baby bunions, what we call Taylor's bunions or bunionettes on this side, and it's just usually just a bump on that side. Easiest way to know if you have a bunion or not is if you start to have pain or if you have any type of bump on the inside or outside of your foot. Bunions, it's usually hereditary and it's a progressive deformity, so as time goes on it gets worse, and sometimes or a lot of times the shoe gear or other types of things can make it worse faster. The best conservative option is our inserts, because as the bunion gets worse, it actually makes your foot flatter. So with our orthotics, it lifts up the arches and therefore slows down the process. Other things that we like to remember is that each toe has 4 nerves, 2 on the top and 2 on the bottom. So with people having bunions on this side, it usually rubs against the shoe, so we do have these bunion sleeves. The other thing is making sure that you're wearing right shoe size, because a lot of times people don't realize that their feet continue to grow. So at least once a year you get your foot measured. When someone who has bunion pain, or what they feel is bunion pains, what we do is we do an evaluation, we take x-rays, we show them what we find on the x-rays so they have a better idea of what's going on. What we do is we give them options that are either surgical or non-surgical, and at that point in time they decide on what they want to do. Our job here at the Kansas Foot Center is to get people back to what they need to do, love to do, sooner rather than later.